Don't forget to like.
Cancer's gender problem. See, right now the Lancet Commission has released a report where they have said is that the cancer is having a gender lens. It has listed certain data to support its arguments. In that, what it has said is that nearly 63% of death that is occurred across the global and most importantly in India also could be prevented by reducing the exposure to the risk as well as early screening as well as diagnosis. And then the 37% of the death could be prevented by timely treatment. So these 63% death as well as 37% death are the death of women who have been affected by cancer and have lost their life. So nearly 63% of death of the women who have been affected by the cancer as well as the 37% of the death of the women who have been affected by the cancer could be prevented by reducing their risk to the exposure as well as the early screening, diagnosis as well as timely treatment. And globally, nearly 48% of new cancer cases as well as 44% of cancer deaths have been occurring in relation to the women. And then it has mentioned certain list of challenges. In that, challenges in providing cancer care to a woman is, first and foremost, is the women are underrepresented in giving treatment to the cancer related incidents in India and also across the global. Similarly, there has been sexual harassment has been taking place while providing cancer care. Similarly, more number of women who have been working to provide cancer care activities to the patients are underpaid. So these are all the challenges in providing the cancer care treatment to the patients, most importantly women patients. And then it has mentioned the certain challenges for women, most importantly for women in relation to the cancer treatment. What are all the challenges is that, firstly, they have challenges in accessing the timely cancer care. Secondly, there is a lack of knowledge prevents across the women in relation to the diagnosis, screening as well as the risk of the cancers. And then thirdly, most of the women are poor in decision making as well as they lack financial powers in relation to accessing the treatment for the cancer care. And then availability of primary service, lack of availability of primary service closer to home is also a challenge for timely treatment for the woman. And then fifthly, it is the lack of health seeking behaviors. Most importantly, the women those who are present in the below poverty section are hesitating to go to an hospital and do a self checkup for their cancer related problems. And then if they have been identified in relation to the cancer, means they are not coming forward for the diagnosis as well as the timely treatment because of the other financial as well as social constraints they have. Sixthly is the social prejudice. Why? Because as I said, the cancer care treatment are mostly provided by men, so that women are hesitating to access the hospital because of underrepresentation of the healthcare service, most importantly the cancer care service being provided by the women in the hospitals. So these are all the challenges right now faced by women in relation to the treatment with cancer care. Okay. So what is the importance of screening the early cancer is the common cancers like breast as well as the cervical cancers are preventable if they have been identified at the earlier stage itself. And in that they have given certain set of suggestions where the breast as well as cervical cancers are the two most cancers in women and are highly preventable as well as treatable. So if they have been detected at the early stage itself, means they could be the other medical cancer related incidents or the cancer related death could be neglected or could be stopped. And then it has for the case of breast cancer, they have said they have recommended the self examination as the one of the type for early findings of the breast cancer. What they have said is that if the woman should selfly identify if there is any kind of lumps that has been occurring in their breast, means they should be immediately accessing the hospitals to check whether they have been affected by the breast cancer. Similarly, for the cervical cancer, a pap smear test has been recommended where the women, those who are belonging to 25 to 60 should do this test to check whether they have been affected by the cervical cancer. Similarly, HPV test, the human papilloma virus, which is the most important virus which is responsible for causing the cervical cancer. So this test has to be made to check whether the human papilloma virus has been present, and it can be done every 5 to 10 years. So these are all the tests that has been recommended by the Lancet Commission, so that early identification of the cancer in relation to the both common cancer, that is the breast as well as the cervical cancer, is identified. So what the government can do is that, first and foremost important thing is that government can create awareness programs so that more number of women could able to know about the early diagnosis as well as the other treatments that is available to them, so that the cancer related deaths as well as other cancer related incidents could be avoided. Secondly, human papilloma virus vaccination program should be made in a mission mode that the cervical related cancer deaths will be avoided. Thirdly, the follow up of the patients, those who have been identified with the cancer, should be made in a strict as well as mission mode. So these are all the things which the government can do. And then the recommendation, what the Lancet Commission has recommended is that there need to be data which need to be collected in relation to the gender as well as the social demographics on the cancer, so that a policy for the cancer, most importantly the data driven policy for the cancer, then among the data driven policy for the cancer, the gender related cancer, the policy for it could be made so that the gender related incidents in relation to the cancer could be avoided. And then developing, strengthening as well as enforcing laws policies to reduce exposure. As I said, with the help of the data that has been collected, the comprehensive policy in relation to the gender dimension of the cancer could be made. And then equitable participation of women in cancer R&D. See, most of the research and development in relation to the cancer is dominated by male members only. So they are, because of their over representation and under representation of the women in the cancer as well as research and development, the gender perspective in terms of research as well as development in cancer as well as the treatment is not fully available to the women population, those who have been affected by the cancer. So equitable participation of the women in cancer R&D should be made. So these are all the recommendations being given by the Lancet Commission. So the news is related to, under prelims it is related to general science. Similarly, under mains it is related to awareness in the field of IT, space, computers, robotics, nanotechnology, biotechnology, as well as issues relating to IPR. Okay. What the other things which we needed to study is, we should know about what is non-communicable disease about, and what is World Health Organization is about, what are all the structure, function, as well as the programs that has been implemented by them. Thirdly, we should know about what is the historical aspect of Adyar Cancer Institute. Fourthly, you should know about Indian Association for Cancer Research. So these are all the other areas which we needed to be aware of.